Why are there so many female infertility causes? Have you ever wondered why female infertility has so many different causes? The female reproductive system is incredibly complex, influenced by a variety of biological, hormonal, anatomical, genetic, and environmental factors. This complexity means that disruptions at many different points can impair fertility. One major reason for the wide range of causes is the multiple physiological systems involved in female fertility. Proper functioning of the ovaries, fallopian tubes, uterus, and hormonal regulation is essential. If any of these systems fail, infertility can occur. For instance, ovulatory disorders account for about 25% of female infertility cases, while tubal blockages and uterine abnormalities also play significant roles. Common reproductive disorders further contribute to the variety of infertility causes. Conditions like endometriosis, which affects about 15% of infertile women, cause inflammation and scarring that can interfere with ovulation and implantation. Polycystic ovary syndrome, or PCOS, is another prevalent condition characterized by hormonal imbalances that disrupt ovulation. These disorders are often multifactorial, adding to the number of potential infertility causes. Age is another critical factor. Female fertility naturally declines with age due to a decrease in both the quantity and quality of eggs. Infertility rates rise sharply after age 35, contributing to the perception of increasing infertility causes, especially as many women delay childbearing. Genetic and endocrine factors also play a role. Genetic abnormalities and chromosomal anomalies can impair fertility in 5 to 10% of affected women. Endocrine disruptions, such as thyroid disorders, can alter the hormonal environment necessary for ovulation and pregnancy maintenance. Environmental and lifestyle influences cannot be overlooked. Exposure to toxins like pesticides and heavy metals, along with lifestyle choices such as smoking and obesity, can negatively impact fertility. These factors may cause hormonal imbalances or damage reproductive organs, further contributing to infertility. Anatomical and surgical factors also come into play. Pelvic adhesions, tubal blockages, and uterine abnormalities can physically prevent fertilization or implantation. Surgical procedures, including sterilization, may lead to infertility as well. Often, infertility results from a combination of factors rather than a single cause. For example, a woman with endometriosis may also have ovulatory dysfunction and tubal damage. This multifactorial nature increases the number of identifiable causes in clinical practice. From the perspective of fertility and endometriosis, it is important to recognize that endometriosis significantly contributes to female infertility due to its effects on pelvic anatomy and ovarian function. Managing infertility related to endometriosis requires a comprehensive approach that addresses both the disease and its impact on fertility. In summary, the multitude of female infertility causes arises because fertility depends on the integrated function of many biological systems. These systems can be affected by diverse medical conditions, age, genetics, environment, and lifestyle. This complexity explains why female infertility is not attributable to a single cause but rather a broad spectrum of factors. If you have concerns about fertility, it is always best to consult with a healthcare professional for personalized advice and support.